Hi, my name is Dr. Stephen Yu. I'm a board-certified colon rectal surgeon in Beverly Hills. I practice at Lapeer Surgical Center. Today I'd like to talk a little bit about pilonidal cysts and pilonidal abscesses. It's a confusing topic, which is a little bit quirky. It occurs because there's actually pressure and the hair follicle on the skin that actually causes an abscess or a cyst. Sometimes it can lead to a lot of pain and sometimes a recurrent situation. The typical patient that does get pilonidal cysts and sinuses are usually younger patients in their 20s or 30s. It forms as a result of the accordion effect of pressure on the skin and the tailbone and the hair follicle, where it actually pulls the hair into the skin and forms an abscess cavity. Simple treatment options include draining the abscess cavity, and sometimes that's enough to take care of the problem. But if it's a recurrent situation, sometimes it requires smaller surgical procedures to fix things, and sometimes it requires a much bigger surgical procedure to heal the wound. Some options include removing the entire tissue that's infected, and sometimes it requires even flap type procedures to revise this. Some people have looked up and seen things like rhomboid flaps. There's also a technique called a cleft lift procedure that actually tries to flatten the crevice in the tailbone area and to heal the wound as well. So a lot of times people will find me because they're looking specifically for a cleft lift procedure, and in terms of procedures, that is definitely reserved for situations where things are recurrent or you have large non-healing wounds. Many times people will find me because they have gone to a general surgeon who has removed that area, and sometimes with the other techniques that are available, you can have a good 2 to 3 month recovery time of very painful wound packing. There are definitely a lot of other options for that area that are more successful for healing these situations. There are situations where people have seen me after 2 or 3 years of having a chronic wound, and they come to me because that wound needs closure. They still are having pain and drainage. There's a lot of factors that prevent this area from healing, including the pressure in this area, including the tension that's always being placed whenever you're sitting. The blood flow is oftentimes restricted to allow good healing. Plus there's a situation where the cavity does not get enough air in order to heal this, and so it really sets up an infection in that area. So there are a lot of treatment options for pilonidal cysts. Not everyone is a candidate for the simple one. Not everyone's necessarily needing the more advanced one. The best thing is really to talk to a surgeon who's had experience in treating all different types to find out which of those are best for that particular patient.